The YouTube channel Reclays is known for producing sensationalized political content, often featuring his opinion. For example, a video titled "Chuck Schumer Arrested After High-Level Security Threat" said at Trump at the White House was flagged by Snopes for promoting false information. The video falsely claimed that Vice President Kamala Harris lost her temper during a 9/11 ceremony, a narrative that was debunked by Snopes. These instances highlight the channel's pattern of disseminating opinion-driven content. Viewers are encouraged to approach the content with skepticism and verify information from more than one source. Is the thumbnail of this video honest? No. There is no credible evidence that U.S. Senator Chuck Schumer, often called Chuck, has ever been arrested. Is the title of this video honest? No. There is no credible evidence that U.S. Senator Chuck Schumer, often called Chuck, has ever been arrested. Is the information in this video accurate? Democrats ask for Kansas to bill. Claim: President Trump was asked to make the Republicans pass the continuing resolution. Reality: true. Senate Minority Leader Chuck Schumer did meet with President Donald Trump to discuss the inclusion of Democratic proposals in a continuing resolution to avert a government shutdown. However, the meeting did not result in a consensus. Efforts to add illegal immigrants to the bill. Claim: efforts are underway to add illegal immigrants to the bill. Reality: there is no indication that Democrats are attempting to add provisions for undocumented immigrants' health care to the current spending bill. The focus remains on restoring Medicaid funding and extending ACA subsidies for eligible individuals. Claim: Democrats proposed a $1.5 trillion spending package. Reality: true in part. The U.S. government's annual discretionary spending bills total about $1.5 trillion, and Democrats, along with Republicans, have been involved in writing and negotiating those bills. But this number refers to the entire federal budget package, covering defense, education, transportation, health, etc., not a bill devoted solely to health care or immigrants. Claim: giving massive amounts of money to illegal aliens for their health care. Reality: false. There is no provision in current or recent Democratic budget proposals that earmarks massive amounts of federal funds specifically to provide health care for undocumented immigrants. In fact, federal law explicitly bars undocumented immigrants from most federal health benefits, including Medicaid, Medicare, and Affordable Care Act subsidies. Some exceptions exist, like emergency Medicaid and certain state-funded programs. Democrats have pushed to extend ACA premium subsidies and preserve Medicaid coverage, but those are for U.S. citizens and eligible legal residents, not undocumented immigrants. Source: Congressional Research Service. Non-citizen eligibility for federal programs. Claim: Americans have had their health care cut. They're going to pay on average $4,000 more per year in higher premiums. Reality: misleading. The number being cited, $4,000, appears to come from Republican talking points about the loss of enhanced ACA subsidies if Democrats' demands aren't met. Analyses: for example, Kaiser Family Foundation, Congressional Budget Office, do show that ending ACA subsidies would raise costs, but the size of the increase varies widely by income, family size, and state. It is not universally $4,000 for all Americans. Source: KFF analysis of ACA subsidies. Claim: Democrats, had 60 votes in the Senate to give taxpayer-funded health care to illegal aliens. Reality: false. There is no record of the U.S. Senate passing, or even having 60 votes lined up for, a bill that explicitly gives taxpayer-funded health care to undocumented immigrants. Some Democrats have expressed support for expanding coverage in other contexts, for example allowing undocumented people to buy ACA marketplace plans without subsidies, but nothing resembling this claim passed with 60 votes. Source: Congressional Research Service report on non-citizen eligibility. Claim: Democrats are willing to shut down the government unless they get their way on this. Reality: unprovable. Both parties accuse each other of being willing to shut down the government when negotiations stall. What is provable is that Democrats set healthcare demands, for example, ACA subsidies, Medicaid protections, as conditions for supporting a funding extension, while Republicans insisted on a clean bill. Whether that equals being willing to shut down is political interpretation. Sources: AP News, ABC News. Claim: $1.5 trillion package tied to Democrats' healthcare demands. Reality: misleading. The $1.5 trillion figure refers to the overall size of federal government discretionary spending under consideration, not a bill strictly devoted to health care for immigrants. Republican leaders labeled Democrats' proposals as a $1.5 trillion ransom note, but that was partisan rhetoric, not a neutral budget analysis. Source: House Republican Study Committee press release. Claim: illegal immigrants are demanding free health care. Reality: false. There is no credible reporting or legislative record showing undocumented immigrants collectively issuing demands in these negotiations. This is rhetorical language, not a factual statement backed by evidence. Source: no verifiable sources found. Claim appears as political framing. Claim: free health care for illegal aliens is one of Chuck Schumer's primary demands to keep the government open. Reality: false. No evidence shows Schumer or Senate Democrats made free health care for illegal aliens a central, explicit demand in shutdown talks. Federal law excludes undocumented immigrants from most federally funded health care. Source: Congressional Research Service, non-citizen eligibility for federal programs. Claim: we will not fund law enforcement unless they get free health care for illegal aliens. Reality: false. There is no record of Democrats conditioning all government or law enforcement funding on undocumented immigrants receiving taxpayer-funded health care. This is partisan rhetoric. Source: no legislative text or credible report confirms this claim. Claim: Democrats proposed a $1.5 trillion spending package, giving massive amounts of money to illegal aliens for their health care. Reality: misleading. The $1.5 trillion figure refers to the entire discretionary spending bill, not health care for immigrants specifically. Republican leaders framed Democrats' conditions as a $1.5 trillion ransom note, but that was rhetoric, not a policy breakdown. Source: Republican Study Committee press release. Claim: illegal aliens, making the demand to change that is to receive taxpayer-funded health care. That's one of Chuck Schumer's primary demands. Reality: false. There is no evidence that undocumented immigrants collectively made such demands in negotiations, nor that Schumer presented it as a primary demand. Source: CRS report on immigrant eligibility for health programs. Claim: some rural hospitals and clinics have closed in recent years. Reality: true. There has been a well-documented trend of rural hospital closures due to financial pressures. Source: AP News. Claim: President Trump has publicly stated that border security is important and that illegal immigration should be limited. Reality: true. Trump consistently emphasized strong border enforcement during and after his presidency. Source: official White House statements and prior public speeches. Reclays is very passionate about and puts effort into his content. I applaud his effort. I encourage you to check out his channel and decide for yourself what you think of his work. You will find a link to his video mentioned here, along with links to information sources in the description below.